My name is Livia Garofalo. I'm a researcher at Data and Society Research Institute. So the project really looked at how providers of mental health services are seeing their profession changing through the shift to telehealth and platform therapy. So what I was really interested in looking at is how their experiences of these shifts are affecting their therapeutic labor and their therapeutic work with their clients, and how it affects the livelihood of themselves as professionals. So since the pandemic, we've seen a lot of people seeking mental health services on one hand, and on the other, sort of the burgeoning of platforms and sort of digital mental health on the other. And so most of the focus has been on the users of these services, right? On many people who are seeking these services and are finding an easier time perhaps connecting to a therapist than before. But what I really wanted to see is what is the cost of this to the providers, right? Who are the therapists who are providing this work, and what are their experiences? I found that therapists have appreciated some of the shifts to teletherapy, right? Therapy used to be something that you did in an office, with a provider in person. And so shifting that encounter to, the internet or through virtual care has been positive in accessing patients and, being more flexible with their own schedules. However, the entrance of platforms has kind of determined a lot of how these providers do their work. They are, especially in some configurations, they're being subject to a lot of dynamics of platformization and gig work that other professions or other kinds of work and labor are seeing. Some of the things that the providers shared was, I, for example, don't have control over how I get matched with my clients. The platform is determining my schedule, it's determining my fee, and so sometimes that is a cost benefit with, not having a private practice or not doing a lot of the administrative load. But some of these therapists felt that the ability for clients to switch therapists anytime was affecting kind of the depth of the work that has to be present for the therapeutic relationship to be successful. A lot of other therapists, mentioned that, it's hard to make a living. So some of the platforms determine how much they can pay per session. And sort of this idea that there's this constant availability of a therapist on the other side of the platform at all times means that the boundaries between work, the boundaries between providers, professional time and personal time get very blurred. And so increasing this feeling of being burnt out, which is already very present in mental health care as a profession. Yes, I think the quality in the sense also of the kind of therapy. So, and this again is, listening to these therapists and saying, because it's so convenient, it doesn't mean that it's always appropriate, for example, to have virtual care or remote sessions. One provider sort of felt like, he said, I feel like I'm an Uber driver. I feel like I am constantly have to be available. And sort of the same logics that are applied to some of those kinds of work are now being applied to something that has to do with healthcare. That is, where there's liability, there's therapeutic responsibility. And so on one hand, there's a lot of increased access for people to access services through these platforms and telehealth in general, but it does come at, a cost of both for providers and users in some cases. That was something that that some providers commented, right? It's like we have remote care, but some people, have very bad internet. Some people don't have a private space in their homes to do therapy. Some people don't have the best smartphone to do, a session that will hold the connection, which is, you're trying to have a space for, quite private things to speak about. And so in a way, it's not that technology solves everything. It allows for people who would have maybe even never stepped into an office because they didn't want to be seen stepping into an office, access therapeutic services. But on the other hand, the inequality that sort of pre-exists and is structural is definitely sort of embedded in how people seek these services and if they're able to receive them. On one hand, there's a lot of sort of algorithmic management, which is not quite AI, that sort of determines a lot of the nudges that the therapist as a worker receives. But, we spoke about, I did ask, like, what do you think about, chatbots and therapy chatbots that are being sort of marketed very aggressively? And sort of there were two different opinions. And on one hand, a lot of fear of being, this is going to be like, some people are going to get the AI therapist, and some people are going to get the real sort of mental health provider. And on the other hand, many providers saying nothing can really replace a human-to-human therapeutic relationship. And even though maybe some of these chatbots might be able to mimic empathy, they are not actually empathetic, right? So it's a very new field that they're approaching as providers. And I feel like therapists are thinking about that, but they also have to keep doing all the actual labor of care that they're doing. But they're sort of balancing sort of the fear with some mild optimism, with concerns that some of these AI chatbots would be causing harm, right? It really changes how therapists find their clients, right? Because they use some of these more direct consumer platforms. You are matched instantly with a provider, and on the other hand, you're matched with a client and user. And some of this dynamic mimics a lot of dating apps. So one provider was saying that it's kind of like a Tinderization of therapy. And so on the side of the therapist, some people, try therapy for a couple of sessions and they drop off, and the therapist gets ghosted by their client. But that doesn't sort of relieve the provider of the duty of care, right? If they're still seeing them in their docket, they still are technically sort of responsible for them and for their care. So it's a double-edged sword, for sure. One of the objectives of this research was also highlighting the experiences of therapists as workers, right? As part of a workforce that has been very under a lot of pressure, especially since the pandemic. And so also letting potential patients and clients know what their therapist is experiencing. I think a lot of what I heard was, teletherapy and platform therapy are here to stay. They're a reality. It has helped many people. Providers just want a say in how this is done. And so having conversations where they can really shape and inform these services and these tools, and not have sort of from the, some of the top of these platform companies determine how these services are delivered without the input of those who are providing them. Having providers involved, and at the top of some of these companies, and some of these companies do have this, right? And also much more transparency on the part of some of these platforms on their compensation, on their sort of practices in general, would make providers feel that they're not being exploited, because that's how some providers felt throughout this process. Yes, I think that's we're in a kind of an interesting juncture, a paradox, right? On the other hand, we're talking about mental health much more, and there is, some lessening of the stigma around experiencing mental health distress. And at the same time, access to services is very unequal still, right? And so that pressure converges on providers and therapists who are trying to manage sort of the traditional challenges of providing therapy with the new shifts to these technologies. ISF was absolutely foundational to doing this project. I was able to speak to 50 providers and do some group sessions with providers. I was also able to, in collaboration with two mental health professionals, actually gather a small group of therapists in New York to have an in-person workshop where we really talked about the difficulties of providing remote care, and also the hopes for the future. What do providers want to see? And so ISF and the whole sort of funding for this project was instrumental in doing that.